نطفة ثم من علقة.
What is rotavirus? Rotavirus is a virus that causes diarrhea and other intestinal symptoms. It's very contagious and is the most common cause of diarrhea in infants and young children worldwide. If you look at a rotavirus through a microscope, it has a round shape. The Latin word for will is rota, which explains how the virus got its name. Rotavirus causes inflammation in the stomach and intestines. It can cause severe diarrhea, vomiting, fever, belly pain, and dehydration in infants, young children, and some adults. Medications can help with the symptoms, but there's no cure for rotavirus. Even children who have been vaccinated against it may get it more than once. Rotavirus symptoms. If your child has come into contact with rotavirus, symptoms won't show up for about 2 days. Then, they'll have fever, vomiting, and stomach pain. Rotavirus usually starts with these symptoms, which then fade away. Diarrhea begins after the first 3 symptoms have stopped. As the virus works its way through your child's system, the diarrhea can hang on for 5 to 7 days. Continued call your doctor if your child has lethargy, frequent vomiting, less desire to drink fluid stools that are black or contain blood or pus, any high temperature in a baby younger than 6 months, a high temperature for more than 24 hours in a child older than 6 months. With all the vomiting and diarrhea, your child may not feel like eating or drinking. This can make them dehydrated, which might even become life-threatening. Older adults, especially those with other illnesses or conditions, could also get dehydrated. Call your doctor if you notice any of these symptoms of dehydration: anxiousness, crying with no tears, little urination or dry diapers, dizziness, dry mouth and throat, severe sleepiness, pale skin, sunken eyes. Adults often have similar symptoms, but they tend to be less severe. Rotavirus causes and risk factors. Anyone can get rotavirus, but it most commonly affects infants, young children, close relatives, those who work with children, such as nannies or child care workers. If your child has rotavirus, it's in their poop before symptoms start and up to 10 days after they taper off. During that time, when your child wipes after using the toilet, rotavirus can spread to their hands. If they don't wash their hands, they might contaminate anything they touch, including crayons and markers, food surfaces such as sinks and kitchen counters, toys, including shared electronics such as iPads and remote controls utensils. Water. If you touch your child's unwashed hands or any object they've contaminated and then touch your mouth, you can be infected. Disinfecting is key. Rotavirus can live on surfaces and objects for weeks. Rotavirus Diagnosis. Your doctor will probably base a diagnosis on a physical exam and questions about symptoms. In some cases, they may have a lab analyze a sample of your child's stool. Rotavirus treatment and home remedies. There's no specific medicine to treat rotavirus. Antibiotics can't touch it, and antiviral drugs don't help. Your doctor may suggest medicine to help with the symptoms and rehydration fluids to replace minerals lost through vomiting and diarrhea. Rotavirus usually works its way through your child's system over the course of a week. During that time, give them plenty of fluids to offset dehydration, including water, broth, ginger ale or clear sodas, ice chips. Bland foods, such as crackers, are best. Steer clear of apple juice, milk, cheese, sugary foods, and anything else that might make vomiting or diarrhea worse. Also avoid sugary sports drinks. Rotavirus Prevention. Frequent hand washing and disinfecting surfaces help, but nothing is a guarantee. The CDC recommends getting your child vaccinated against rotavirus. This will make them less likely to get it. If they do get it, the symptoms will be less severe. How is the rotavirus vaccine given? There are 2 brands of the rotavirus vaccine: Rotatech, RV5, and Rotarix, RV1. Both vaccines are given orally, not as a shot. The only difference is the number of doses that need to be given. With Rotatec, 3 doses are required. They should be given at ages 2 months, 4 months, and 6 months. Rotavirus only requires 2 doses at 2 months and 4 months. The vaccine may be given at the same time as other vaccines, and the American Academy of Pediatrics recommends that the rotavirus vaccine be included as part of the routine immunizations given to infants. How effective is the rotavirus vaccine? Studies of the rotavirus vaccine have shown that it can prevent about 74% of rotavirus infections. More importantly, it can prevent approximately 98% of severe infections and 96% of hospitalizations from rotavirus. In one Massachusetts hospital, in 2 years, the number of people with rotavirus dropped from 65 to 3. Is the rotavirus vaccine safe? Before being approved, the rotavirus vaccine was tested on more than 70,000 children and found to be safe. However, an earlier vaccine, called Rota Shield, was removed from the market after being used for 2 years, because it was found to slightly increase the risk of intussusception, a condition in which the small bowel folds back inside another part of the intestine, causing a bowel obstruction. The Rotatec and Rotavirus vaccines now in use do not appear to increase this risk and are considered safe. Are there some children who shouldn't have the rotavirus vaccine? Any child who has had a severe allergic reaction to an earlier dose of the rotavirus vaccine should not be given any more doses of the vaccine. If your baby has a moderate or severe illness at the time the vaccination is scheduled, wait until the baby has recovered before being vaccinated. Also, the CDC recommends that you check with your doctor if your baby's immune system has been weakened. Things that could compromise the immune system include exposure to HIV/AIDS or any other disease that involves the immune system, treatment with long-term steroids, cancer or cancer treatment with X-rays or drugs. What are the side effects of the rotavirus vaccine? With any vaccine there is chance of a serious allergic reaction. Signs of an allergic reaction can include difficulty breathing, wheezing, hives, paleness, fast heartbeat. However, with the rotavirus vaccine, the risk of a serious reaction is extremely small. Most children who get the vaccine have no problem at all. However, there is a slight chance your child may have temporary, mild effects following the vaccine, including increased irritability, diarrhea, vomiting,